Let me first describe what levels of magnetic field are associated with elevated risk of cancer. Magnetic field in the US is measured by the units of milligauss. Internationally, it's microtesla, but let me talk about milligauss. The studies of childhood leukemia in relation to power line exposures show very convincingly that living in a home with magnetic fields of 4 milligauss increases the risk of cancer. There's a lot of evidence that probably the threshold is 2 milligauss, but 4 milligauss was clearly associated with elevated cancer. I had not previously been very much involved in electromagnetic fields, although I worked for the Defense Nuclear Agency at the Armed Forces Radiobiology Research Institute, where some of my work was related to ionizing radiation. Then I accepted the job as the director of the Wadsworth Laboratories for the New York State Department of Health. 2 weeks before I started my job, there had been a settlement between the State Public Service Commission and the state utility around the question of, do magnetic fields from power lines cause childhood cancer? There had been one report published in 1979 of a study in Denver, Colorado, where sort of a foot-soldier epidemiologist had gone around the city looking at homes where children had been diagnosed with leukemia. And she found that many of those homes had neighborhood distribution lines close to the home, and these distributions had thick wires. So a thick wire meant there was a high current there. And that study reported that there was a significant elevation in cancer in homes that were exposed to high magnetic fields. That became one of the critical questions, and I was given the responsibility of then administering a $5 million program, money assessed from the New York State utilities, to determine whether there are adverse health effects from magnetic fields, focused particularly on high voltage power lines, but also on neighborhood power lines. One of the 13 studies that we supported was specifically designed to be a replication, but performed better, of this 1979 study. To my surprise and to the surprise of many other people, we replicated the study. It was done better. We used both this wire code configuration, which was just looking at the distance from the house and the thickness of the wire, but we also made magnetic field measurements in the homes and confirmed that high magnetic fields was a risk factor for the development of childhood leukemia. Now, we had another study in Washington State looking at adult leukemia, and that study did not find any significant effect. So after our New York State Power Lines project was completed in the late 1980s, I became the official spokesperson for New York State on the whole issue of electromagnetic fields. It had never been my personal research, but once you get involved in a controversial area like this, you never escape, and I'm still very much involved in that debate.
How many years has it been, and what's your background?
Well, I have an MD from Harvard Medical School. I had a wonderful experience in my last year as an undergraduate doing a honors thesis research project with George Wald, who ended up getting the Nobel Prize for studying the visual system. By that time, I had already been admitted to medical school. I got into medical school and I was a little disappointed. All you had to do was memorize. You didn't have time to think and do research. So I did go to medical school, but I took a year off after my second year. I went to Sweden to do research, studying the brain. Came back, enjoyed my third year of medical school, which was all in the clinic, But in the beginning of my fourth year, realized I really didn't want to practice medicine, at least right away. I thought, let me do research for a while, and when my brain shrivels up, that I can go back and practice medicine. I've never actually gone back, although I use my medical degree every day in terms of understanding human disease. I became a commissioned officer in the U.S. Public Health Service, went to the National Institute of Mental Health,
Mm.
worked there for 7 or 8 years. Then I got a new lab chief that wasn't interested in my kind of research. And that's when I moved across the road to the Naval Medical Center in this radiation laboratory. I didn't know anything about radiation, and I was only recruited because I was a good scientist. And at that point, ionizing radiation wasn't a very high priority area. So I became the chair of a neurobiology group in an atmosphere where radiation was being studied by lots of other people. I became rather interested in it. There was across the gully a major Navy program on studying the effects of radar, because already there had been allegations that service people exposed to high levels of radar were getting diseases, some of them which are very much like what we now call electrohypersensitivity. Uh, I wasn't involved in those studies, but I visited them on numerous occasions. So then, when I was recruited to New York, one of the reasons they were interested in me as the director of a public health laboratory, and at that time I did not consider myself a public health expert at all, but one of the things that they were interested in was my background with ionizing radiation. Remember, what were the big issues, public health issues about that time? 3 Mile Island was a major one. That had 3 Mile Island in Pennsylvania was just before I came to New York. The other one was Love Canal, which
Mm.
was chemical exposures. And a lot of my work on the brain had been related to chemicals as well as to radiation. So that was my background. And suddenly I'm the director of a 1,000-person laboratory covering infectious disease. HIV was developing just at that time. Uh, it was a quick learning curve to become a public health person. And that's what I've been involved in ever since. Because of this work on the New York State Power Lines project, while it's not been my personal research except for literature review and that kind of thing, it's something that I've been very much involved in. Uh, Still, my major focus of study is human disease in general from environmental exposures, mostly chemical exposures, but EMF fits right into that pattern. So I really became involved in study of EMF after I came to New York in 1980. So I've been involved in EMF issues for 45 years. It's important for the health of the public. And as a public health physician, I think that's my responsibility to try to identify threats to human health and identify ways in which we can reduce those threats. Let me start by describing the paper I published several years ago on the evidence for a relationship between exposure to magnetic fields and childhood leukemia. Uh, as I said, that was my first real that issue was my first real involvement in the EMF work because of the New York State Power Lines project. Well, after our report, uh, which basically was the second major study showing an association between magnetic fields from power lines and childhood leukemia, that triggered a lot of interest in that subject. And in 2000 or just before 2099 or 98, there were three major meta-analyses that reviewed that whole literature. And all three of them concluded that there was a small but statistically significant elevation in risk of childhood leukemia in relation to exposure to magnetic fields from power lines. The strongest was around high voltage power lines. Those studies had not been in the US, but they came from Scandinavia. And then there were a number of studies in the US around distribution lines, neighborhood distribution lines. Well, when I wrote that report, which was published in 2019, there were a number of reports coming out, both in the press and in scientific journals, saying that the results from exposure to magnetic fields in childhood leukemia were inconsistent and inconclusive. Well, from my personal experience involved in the research, I didn't believe that. So I took it upon myself to review all of the data that had been published between 2000 and 2017 when I wrote that paper, and looked at the results of every study I could find in the literature. And there were something like almost 30 such studies. What I found is 12 of those studies, these are original studies, not reviews. 12 of those original studies found statistically significant elevations in risk of childhood leukemia in relation to exposure to magnetic fields from power lines. There's also, of course, exposure from appliances, but they're more difficult to measure. So this was limited to power lines. Now, of those 12 studies, 11 were funded entirely by government or foundations. One study was funded by EPRI, the Electric Power Research Institute. There were another 6 or 7 studies that reported an elevation in risk. And in epidemiology, we use odds ratio as a measure of risk. These had odd ratios of 1.5 or higher, that meaning almost a doubling of risk. But the results were not statistically significant. In other words, the confidence limits, which are standard use in epidemiology, if the lower bound is less than 1.0, it's considered not statistically significant. But an elevation of 1.5 is not trivial, and it's suggestive of there being a positive association. In contrast, there were another 6 or 7 studies that found no elevation in risk whatsoever. Every single one of those was supported by the industry. Now, if you look at that overall picture, you must draw the conclusion that the results are not inconclusive and inconsistent, provided you throw out those results that are funded by an industry that has an obvious conflict of interest. And I think what industry has managed to do by these studies, I don't mean to imply that all of this was intentional deceit, although I suspect a lot of it was. But industry has managed to confuse the perception by regulators, by government, by individuals, that this is not a serious public health hazard. And that's untrue, and it's unethical, and should be illegal to have that kind of deceit fostered on the whole public. The result was that funding for further research was basically cut off. We have absolutely no such research in the US now, except occasionally a report coming from industry, which almost always find no adverse health effects. That's where we are.
The EPA was tasked to and working on developing safety standards, but then never did back in the 90s because of the studies that seemed to show no effect that were put out there in the media. Can you talk about the because you were there through the whole thing. So
I
about
certainly have been there through the whole thing. There's several issues there. There were major programs in the federal government at EPA and the Department of Energy. And the Department of Energy actually had a very strong program and funded research at various places. Then there became to be this controversy, especially coming from industry publications. You asked about the National Council on Radiation Protection and Measurements. There was a major committee set up there, chaired by Ross Adey from California, who was a leader in research in that field. Ross became ill, and although many of us worked on that for a long time, contributed chapters, it never got published. The funding at EPA had disestablished their research program entirely. The Department of Energy allocated no additional funds, and basically all research on this issue of extra low frequency EMFs came to a halt, including the publication from NRCP. The head of EPA at that time, I believe that was Gorsuch, the Supreme Court Justice's mother, had a major role in cutting funding for all EMF research. And, a lot of the decrements in the federal funding came from pressure from the industry. Everybody needs power lines. We need electricity. That's not the point. But acknowledging that even though it's something that's valuable, there's a health hazard associated with it, only makes some sense. But when the industry has political power and the consumers aren't knowledgeable or informed, and the scientific community was involved in many other things, that's what caused the demise of almost all activity in the US focused on study of electromagnetic fields. You do have to have substations, and substations are going to have high magnetic fields around them, but they should not be placed near places where people, whether children or adults, are spending large amounts of time. Now, there are other ways to reduce exposure. Buried power lines basically don't generate high magnetic fields that expose people. The reason is that electricity in a power line, you have current flowing one way, and then you have current flowing another way on the return line. Magnetic fields are vectors. They have directions. And when the two lines carrying currents in opposite directions are close together, the magnetic fields cancel each other. So a buried line does not cause elevated magnetic fields at the surface. Now, the magnetic fields from our power lines penetrate homes, penetrate walls, penetrate bricks, and they spread for long distances if they're not buried.
the IEEE limit is 9,100 milligauss, and the ICNIRP limit is about 2,000 milligauss. Those are the limits that industry brings out when people raise health issues.
Those are totally irresponsible limits. Those are made either by engineers and physicists who are ignorant of the biological literature, or if they're not ignorant, they're deceitful and they're resorting to lies in communication and in setting limits. This is the real problem because the government agencies take those limits by national and international agencies and use them to dismiss all of the research that has been done in the biomedical community showing that the hypothesis that only tissue heating is important in terms of decrements to human health. That is simply not true. It's not true, and the evidence that it's not true is just overwhelming, but it's ignored. And that triggers this response that the associations are inconsistent and inconclusive because industry has perverted information that gets out to regulators, to policymakers, and also to the general public and the press. The press plays a major role here. They're fed a report that IEEE, ICNIRP, FCC have these standards that are much higher than what's measured, and most of the people in the press don't know the difference. They don't know the scientific literature, and therefore they feed the public the line that there's no reason to be concerned.
I've only worked on this for about 15 years, but what I keep getting hit with is, well, there isn't any peer-reviewed published science. And I'm always astounded that here we are in 2026, and I'm still being told that sentence when there are hundreds of studies, thousands of studies showing effects, a variety of biological effects or associations with long-term health risks and so forth. But that is what
That's what we're dealing with.
And ICNIRP is a small invite-only group that was funded, as I believe, with a scientist who had industry money to start these two organizations, the EMF, the WHO EMF project, as well as ICNIRP, were started by Michael Repiccioli.
That's absolutely correct. Repiccioli. He previously worked for WHO in the position that Vandemeter has now. When he retired, first of all, he retired and immediately went to a cell phone group in Italy. But before he retired, he created ICNIRP as an official NGO. And WHO is a very bureaucratic organization. So if you have an official status, that's very important to them. And once you have an official status as an official NGO, apparently it's sort of never ending. And you can't have any other organization that would counter views expressed by that official NGO. Policymakers need to know that there's an enormous body of evidence. But, we've presented that. The bioinitiative report's probably the best example. Encyclopedic evidence written by experts in the field. It has had little impact, but not the impact it needed to have, because they buy the line that if the World Health Organization says you don't need to worry, we don't need to worry. If the Federal Communications Commission sets standards and that the exposures we're talking about at the 49ers Stadium are below those standards, then you don't need to worry. I'm very frustrated at knowing how to get past this barrier. It's been a barrier for 50 years or more, and it remains a major barrier. I got actually threatened with a lawsuit when the Power Lines project ended, because I said on camera that it was very dangerous to use an electric blanket. Now, why is an electric blanket so dangerous? Well, it's got a current flowing through it, and you're sleeping for 7-8 hours a night with right next to your body. The magnetic fields from appliances decrease rather rapidly with distance. They go away on average of about a foot, depends on how much current is flowing. But if you want to use an electric blanket, heat up your bed before you get in it and then turn it off. Quilts are great. I got threatened with a suit by a major corporation that manufactures electric blankets because of my statement saying I was harmful to their business. Well, a year later, they came out with a new product, an electric blanket that doesn't generate large electromagnetic fields. They never followed up with their threat to sue me. And they'd done something very similar. In the old electric blankets, you had wires going here, sort of in a pattern. And as I mentioned earlier, if you put wires close together, the magnetic fields balance. So what they do is created an electric blanket where the wires went like this, and then like this, and then like this, instead of like this. And the magnetic fields were much, much lower. Now, we talk a lot about the radio frequency fields. Don't hold the cell phone to your head. Keep it away. Use it on speakerphone. But the same thing applies to the magnetic fields from electricity. Uh, don't keep electric appliances close to your body for long periods of time. Step away from them. Another example that has been repeatedly brought up against me as being some kind of radical leftist person. At the time that a lot of this research was going on back in the late 90s and early 2000s, I was quoted on television that I measured the magnetic fields in my young son's bedroom and found that they were high on one side of the room and low on the other side. So what I did was move his bed from the side that was high to the side that was low. The reason it was high on one side and not on the other side was the side that was high is where all of the electric wires were placed. And there were no wires on the other side. Well, I don't think that was a crazy thing to do. I think it was a responsible thing to do, but it didn't impact our quality of life in any way, shape, or form. But unless one has some knowledge of the danger associated with these fields and the relatively simple things you can do to avoid them, it's important to have that knowledge. I still get calls from people that are contemplating buying a new house. And the question is, there's a big power line near that house. Should I be concerned? My answer is always, you should be concerned. You should become knowledgeable. For example, in the studies around high voltage power lines, all from Scandinavia, they demonstrated that the magnetic fields go for a much larger distance than they do around appliances. And they go back to a background level at about 300 meters distance. 300 meters is almost 1,000 feet. So if there's a high voltage power line and you don't want to have your family exposed to elevated levels of magnetic fields coming from it, don't buy a house which is in about 1,000 feet. If you're at 800 feet, it's not going to be that much higher. If you're less than 100, 300 feet, it's going to be significant. Like every hazardous exposure, what is really important is the aggregate exposure. And that's a function of the intensity of the magnetic fields and the time you are there. So using a hairdryer can give you a high exposure for what, 5 minutes? If you live in a home that's close to a high voltage power line, you're exposed to a lower level, but for every minute that you're in the home. And of course, for children, that tends to be higher than for adults. But even for adults, at least you're in the home while you're having dinner and while you're sleeping. So multiple hours a day. So aggregate exposure is a key factor here. The aggregate exposure to electromagnetic fields in general has just gone up enormously over the last few years. Now, a lot of that is radio frequency exposure, not magnetic fields from electricity. But we are an electric environment. We all depend on it, and we're all, for the most part, oblivious to the adverse effects of the magnetic fields from electricity, also the radio frequency fields coming from all sorts of wireless devices.
If you're pregnant, is this an issue to care about, and the issue of non-ionizing electromagnetic radiation?
This is definitely an issue for pregnant women. Again, there haven't been that many studies, but the studies that have been done have shown an elevation in the risk of childhood leukemia if the mother's exposed to magnetic fields from electricity. That's several papers coming out of Canada. Now, there are a couple of other papers that did not find that association. There are also several publications showing that the father's exposure can increase the risk of cancer in the children. Those references are all in my publication on that we talked about earlier from 2019. There haven't been as many of those studies. They're difficult to do, but that's a reason for concern. Any woman that's pregnant should take extra care about exposure to a host of things, because as the fetus is developing and growing, they're more vulnerable than at any stage of the human life. Young children are more vulnerable than older children, than adults, but the fetus is the most vulnerable.